Sonia Traylor is a mother of two living in Atlanta. While she appears healthy, this 25-year-old knows that she's going to die of a terminal disease. She told CNN on February 8, 2013 that her 9-year-old son wouldn't touch her, hug her, or kiss her anymore. She faces the daily battle of being stigmatized by society and not knowing if the next time she gets sick will be her last. Traylor epitomizes the struggle of a new generation of youth living with HIV and AIDS. A recent report by the Centers for Disease Control on November 30th, 2012 contained the relatively good information that HIV infection rates across the country have stabilized, and that global trends even show a decrease in infection rates. However, the CDC report also contained the alarming information about the dramatically increasing infection rates of a surprising group, 13 to 24-year-olds. 25% of all new HIV cases in the United States are among young people, with 1,000 young adults contracting HIV every month. That's the equivalent of 3 times the number of competitors at this tournament getting infected, or one person getting infected, in the 60 minutes it will take to complete this round. As Dr. Thomas Frieden, CDC director, told PBS Frontline on December 1st, 2012, that after 30 years of fighting the disease, it's just unacceptable that young people are getting infected at such high rates. Since it is our age group that is most affected, we must take action. First, we'll establish the problem of this new epidemic, then delve into why teens are most affected, before finally outlining some essential solutions needed to control the spread of this plague. Since emerging in the 1980s, HIV has been viewed as a major threat to public health. But in the last few years, that threat has become very real for a younger group of Americans. The problem is visible in 3 main ways: the number of teens affected, HIV status ignorance, and the devastating consequences. First, the number of teens affected is astounding. The Department of Health and Human Services notes on August 21st, 2012, that those that are most affected are teens, and that of the 12,000 annual new HIV infections among this age group, 70% among 13 to 19-year-olds are black teens, and 9 out of 10 adolescent male infections come from same-sex contact. Although HIV infection rates are up in all demographics of this age group, the dramatic rise in these 2 groups is the most alarming aspect of the problem. And compounding this issue is the staggering number of youth that are unaware of their HIV status. The Morbidity and Mortality Report of November 30th, 2012 claims that more than half of the youth living with HIV, a whopping 60%, are not aware of their HIV status. They risk unknowingly spreading the disease to others and are least likely to receive treatment to keep the virus in check. And this results in some devastating consequences. While advances in drug technology have made HIV a treatable disease, NPR of July 27, 2012 observes that more than half of those diagnosed with HIV do not receive treatment and care. And those that do face the difficult and stigmatizing decision of telling their families that they're positive so they can receive treatment. But how is it that HIV infection rates have once again begun to rise at an alarming rate? Let's look at some of the causes, which include pervasive apathy and the continuing lack of education. The previously cited CNN states that for a new generation of Americans, HIV has become a faceless disease, one that isn't talked about. And the very fact that HIV is both treatable and faceless has produced a startling apathy among youth toward the disease. Mike Gifford, president of the AIDS Resource Center of Wisconsin, commented on the Milwaukee Journal-Sentinel of February 8, 2013, that those at the highest risk weren't born during the height of the AIDS crisis. They never saw anyone die. What they're used to is seeing people taking a pill and living with it. As a result, young people may be aware that HIV is a disease, but don't feel threatened by the consequences. The effects of this apathy are revealed in a study by the New York Community Healthcare Network published January 2013. They found that while 80% of respondents claimed they knew how HIV and AIDS was spread, 47% still decide to engage in unprotected sexual activity. stigma and ignorance about youth seem prevalent as ever, and much of the fault falls in education policy. A study by the Guttmacher Institute published March 1st, 2013, notes the correlation between those states that lack the most comprehensive sexual education requirements and those with the highest rates of infections. Health classes in these schools, like Florida, aren't required to provide any kind of medically accurate information about HIV. Furthermore, even if teen gets exposure to sexual education, it's often biased and stigmatizing towards gay, lesbian, and bisexual students. The Guttmacher study notes that only 11 states require any discussion about sexual orientation, and that 3 of those states require the discussion about homosexuality be solely negative information. Even New York State, which has some of the highest regulations on sexual education, is failing its LGBT students. A 2012 report by the New York Civil Liberties Union titled Birds, Bees, and Bias claims that the near representation or failure to represent same-sex couples in sexual education means that LGBT youth might mistakenly believe the HIV education they receive doesn't apply to them. Apathy and educational failure has allowed a generation of youth to be stopped by a killer. But now is the time to stop that as we explore some of the solutions, which include personal and policy changes. First, we need new education mandates. The National Conference of State Legislature website, updated March 18, 2013, claims that the state level is what requires these educational mandates. Only 18 states require that HIV information be medically accurate. And of those states represented at Faro Pi, only California, Oregon, and Texas have such requirements. We must be active in our local school districts to ensure LGBT inclusive HIV/AIDS education is a part of any curriculum. Second, we need to be responsible for our own actions. We can't solely rely on state regulation to combat apathy and ignorance among youth. There are steps that we can take. First, since we know 60% of those living with HIV are not aware of their HIV status, that's a statistic we can change immediately. If you haven't been tested within the last 6 months, it's time for an HIV test update. Free clinics are virtually everywhere, and results only take a matter of days. Log on to hivtest.cdc.gov to find your local free HIV test clinic. And finally, join the Peer Education Program. Wendy Arnold, the founder of the Peer Education Program of Los Angeles, comments on a personal interview conducted March 20th, 2013, that this unique program uses young people like us to educate other youth about HIV issues, such as prevention and the stigmatization of those living with the disease. As speakers, we understand the power that our words have. Let's make sure by educating that other youth, we give our words the power to save lives. Today, we tackled the HIV issue by first looking at how many teens were affected, delving into why they're most affected, before finally outlining some essential solutions to protect our youth from this deadly virus. The previously cited Milwaukee Journal Sentinel claims that everyone needs to unite to protect the most vulnerable populations. Because if we don't, the numbers will keep rising. And it's people like me, Sonia, who receive stigmatization by not only her peers, but even her own son. But after she explained how HIV and AIDS works, he said, "Okay, Mom, I'll still love you all the same." Let's make sure that our actions can protect and educate future generations.